In our last session, we discussed and had Samantha share coping mechanism to deal with the emotional impact of colorectal cancer on patients. Colorectal cancer touches everyone, and we also have in the audience caregivers and family members. So our next session is for you, and entitled Emotional Impact of Colorectal Cancer on the Caregivers and Family Members. We'll have a short presentation by Carly Berlin. Carly is a Master's of Social Work graduate from McGill University. She works in Hope and Cope, the Wellness Center, as a program manager. Hope and Cope is a non-for-profit cancer support organization based in Montreal and affiliated with the Jewish General Hospital. After Carly's presentation, we'll have a panel discussion with two caregivers, Enza Ricco and Matthew Ross. We will end the session with an opportunity for you to ask questions to our panel members. You do not have to wait until the end, so feel free to add your questions to this section on the top right, and we will get to them in the Q&A section. So with that, Carly, the floor is yours.
Thank you so much, Dominique. Thank you to Colorectal Cancer Canada for having me. Again, my name is Carly Berlin. You just learned a little bit about me. I am a social worker by profession. I currently manage supportive and educational programs at Hope and Cope, and I also provide psychosocial support to cancer survivors and family members as well throughout the course of a cancer diagnosis. So I'm sure you've seen a little bit of this already throughout the different presentations. According to the Canadian Cancer Society, 12% of all new cancer cases in Canada in 2020 are predicted to have been cases of colorectal cancer. It's the third most diagnosed type of cancer in Canada. And 5-year net survival rates are quite high at 65% for men and women. But with these net survival rates and the fact that increased screening is leading to declining rates of cancer diagnoses in males and females, the overall rates might be declining, but actually colorectal cancer in younger adults, so people 20 to 49 years old, is actually on the rise and has been for a number of years. And I just want to take a minute to acknowledge that the demographics and realities of younger patients and caregivers means that, there may not always be as established a support network. There are major milestones that end up having to get put on hold, let's say, choosing a partner, a profession, educational goals, family and fertility desires and wishes. And it can really magnify and prolong the long-term effects of cancer. So something important to acknowledge, especially in terms of colorectal cancer in Canada. So let's talk a little bit about who is a cancer survivor. At Hope and Cope, we use the definition that the National Coalition for Cancer Survivorship uses. So someone can be considered a cancer survivor from the moment they're diagnosed for the balance of their lifetime. So it's not just about living with cancer, it's about living with cancer, living through it, and beyond the diagnosis. And for all intents and purposes, family members and caregivers of a patient, we consider them co-survivors. They're surviving this. They're going on this parallel journey with cancer, just right alongside the patient. And sometimes those parallel journeys converge at specific moments, at pivotal moments throughout the cancer trajectory. And we'll get to that a little bit later in the presentation. But our time together in this presentation is really over everything, is to shed light on the caregiver and this parallel experience that they're going through. These co-survivors have their own reality, and by supporting caregivers, we can further support the person who actually is going through the diagnosis. So this is from the National Cancer Institute, and it talks about how an individual's ecosystem and that of their caregivers is impacted by a cancer diagnosis. So there's kind of this evaluation process where you look at sort of the health threat of what cancer is. Some of the antecedents that can contribute to the magnitude of the impact of that health threat, that cancer diagnosis. So someone's age, I mentioned before, the unique experience of a young adult with a cancer diagnosis. Their gender may have an impact on things, their health status before a cancer diagnosis, and their employment status. And this is true also of the caregiver themselves. What was their truth before the diagnosis of the person they're taking care of? Some of the secondary things that are involved in evaluating the impact of cancer on caregivers' ecosystem is sort of, what kind of daily living tasks are going to be impacted? What kind of information do they have? What kinds of practical things like transportation are going to be affected and required of them? And how are decisions going to be made? And then what's really important is this last box here of resources. What resources are available to the caregiver and to the patient? What kinds of social supports, emotional supports are available? What does the relationship with the healthcare team look like? What kinds of interventions are going to be required? And are palliative care consultations necessary, and how are they going to be done, and will the caregiver be included in that? And I just want to remind people that palliative care, just to demystify it for a second, is not only end-of-life care, it's also pain management. So that's something important to keep in mind, because pain management can make a massive difference for both the patient and for the person taking care of them. So then this kind of evaluation leads to, how is a caregiver going to cope with this particular experience? Do they have the resources that they're going to need to deal with the demands of the diagnosis of the person that they're caring for? So are the resources greater than the demands, or are they in need? Is there kind of a lack of resources required, or is there a lack of resources available that are going to be needed to deal with the demands of the diagnosis? And then it's going to lead to how people are able to cope. Can we cope from a problem-focused point of view? So just dealing with things as they come up. I call this kind of like the Band-Aid solution. Is it more emotion-focused? So are we going to acknowledge how this is going to impact the caregiver and the family? Or is it meaning-focused? What does this diagnosis mean for what life was supposed to look like for the person going through cancer as well as their caregiver? And so then either it's going to lead to some positive or some negative psychological consequences, and it's going to depend on what kinds of coping strategies and resources are made available to the person throughout their caregiving experience. So caregivers have a very unique experience with cancer. Now that we've considered the potential impact of colorectal cancer on the caregiver, let's look at what caregivers say about how they see the support, how they see those resources that are hopefully greater than the demands of the diagnosis. So this specific diagram is from a study that was done in Australia, specifically asking caregivers how they saw social support within the treatment setting for the person they were taking care of. And these were the three main themes that the caregivers identified as most important. And so this is from this one study, but I have to tell you that anecdotally in practice, this really reflects, I think, what's important for caregivers that I've been seeing as well. So the three things are the treating team as a source of support. So does the caregiver understand the impact of the disease of the person that they're taking care of? Do they feel like the treating team is offering them a personalized experience? Do they feel like the treating team is competent? Do they feel like their questions are being answered? And are they being acknowledged as a caregiver? A lot of the time, the doctor or the treatment team will focus on the patient, and that's really important. But for caregivers, it's really important to acknowledge them as well. Another thing is how existing supports can really change through a cancer diagnosis for the caregiver specifically. So it's very, I think it goes without saying that cancer changes everything. What was reflected in the study and what I hear every single day from caregivers, regardless of cancer diagnosis, whether it's colorectal cancer or other, is that there's a reluctance on the part of the caregiver to even ask for support. There's this feeling of like, it can't be as bad for me compared to what the person I'm taking care of is dealing with. So what right do I have to ask for support? And that's really important to remember and to keep in mind. Caregivers have the right to ask for support. And then there are these two last points, supports that you thought that you expected to be there for you might let you down. This might be people in your life that, you thought would step up and help you that end up kind of not really being there for you. And then there are these other resources, maybe small nonprofits that you didn't even know existed, things like Colorectal Cancer Canada that can jump in and be a support to you as a caregiver, and things stepping up where you didn't expect. The last thing is differing dimensions of support. So acknowledging the fact, this to me as a social worker is an important part of things, because it's not only about the emotional support, but it's also about the practical stuff that come along with a diagnosis like this. what does a cancer diagnosis mean, for example, for a family where the patient is maybe the primary breadwinner of the family? Are there financial supports available? What kind of burden does this place on the caregiver? Practical support, if we're thinking of a nuclear family and one spouse is taking the other to treatments and taking care of them, how are the children being taken care of? Do they have meals? Are they able to do their homework on time? What kinds of practical supports are needed within a family? And the shared experience. This is when incidental support here is listed as, things that I would say, people that you might meet in the waiting room that you never thought would be a source of support for you. So I'm going to try and go a little bit faster to get through everything. So as you might have seen from the last couple of slides, the most important parts that I've seen both in my work and through some of the literature is that knowledge is power. The more knowledge a caregiver has, the more supported and empowered they will feel to understand what's going on, to understand the impact on them, on the person that they're taking care of, and what this means for their reality. Recognition, like I said before, caregivers are going through this parallel journey with cancer, equally important, very different. And they need support and validation just as much as the patient in very different ways. Referrals are important, so making sure that the caregiver has access to different sources of support and different resources, and that information sharing, which goes back to knowledge, knowing what to expect. And so this is where the importance of the lived experience can come in, and I'm going to talk a little bit about what Hope and Cope does, and really the importance of peer-based resources, so people that have been there before. The importance of trusting your healthcare team, identifying and communicating the needs of the caregiver, even if you feel like you have no right to do so, you do. And in terms of the unique experience of colorectal cancer caregivers, actually specifically the American Society of Clinical Oncology really recommends in their guidelines to involve the caregivers as early as possible in the disease trajectory to be proactive and inclusive, especially at key decision points. That's where those parallel journeys converge and kind of meet up. So a little bit about Hope and Cope. We have been in existence for 40 years. We were founded in 1981 by an incredible woman named Sheila Kussner. We work with about 400 volunteers, most of whom are cancer experienced and cancer survivors themselves. I'm lucky enough to work with these volunteers, we just guide them. We give them the tools that they need, and they go and they fly, and they're the ones that deliver all of our programs. And that's what makes the biggest difference, is that peer-based support from a background of, I get it because I've been there. And we provide support from diagnosis through all stages, including palliative care and bereavement. I'll skip these slides because we've talked a little bit about it before. We provide psychosocial support. We are guided by professional staff driven by cancer-experienced volunteers. A little bit more about who we are. We're very connected with the Jewish General Hospital in Montreal, but we're also very connected to an extensive network of community and academic organizations, and we're open to anyone with any cancer diagnosis across the island of Montreal and beyond. So a little bit about the practical emotional support that we offer. Like I said, that peer support, that lived experience, we offer one-on-one peer mentor pairings, which can make a huge difference. And those are for caregivers just as much as they are for patients themselves. The lived experience of a caregiver is something where you get to kind of be honest and, really talk to someone because they get it and they've been there. We have coping skills workshops. So these are practical workshops, talking about different ways to cope, identifying your needs. And the biggest thing that we do is we try and break isolation and find validation and help you find validation in your experience. And we're accessible, we're free. Everything that we do is free. And that's really important because we want to make sure as many people as possible are able to access what we do. Just a reminder that it's not always a happy ending with cancer, and that, our support of co-survivors of caregivers and family members doesn't end if somebody dies, unfortunately. We do have bereavement support as well. And a quick note about COVID-19 and cancer survivorship. This has kind of highlighted a new way for us to be able to provide support. Lots of virtual support, lots of virtual wellness activities over Zoom. And what we're seeing is that people are logging in when they were possibly too sick or too busy to have come to us in person. So we've actually seen an uptick in some of our services, especially support groups. So in conclusion, coping looks different for everyone, for every caregiver, but caregivers deserve to be seen, included, and acknowledged throughout the course of the treatment of the person they're caring for. Transparency is really important. Like I said before, involving the caregiver as early as possible, and making sure that there are psychosocial and practical resources specifically dedicated to someone taking care of someone with cancer. Just a note on a couple's relationship, it can really impact long-term survivorship. So again, with that transparency, if there is a spousal relationship in the caregiver-patient dynamic, it's really important to transparently, that fear of cancer recurrence after, because that can really have an impact on long-term survivorship. I think we're going to go straight to the panel, and then I'd be more than happy to answer any additional questions you might have. So thank you very much, and over back to you, Dominique.
Thank you so much, Girlie, and thank you for the passion. Now we are being joined by Enza and Matthew to share their caregivers and family members' perspective. So maybe we can start by having you two introduce yourself. Enza, would you start and share a little bit more about yourself and your story with us?
Sure. So my name is Enza. My husband, Vito, was diagnosed with advanced cancer about 3 years ago. We're almost going on 3 years this summer. It has been a very arduous journey, I have to say, just in terms of his health. He had cancer, colon cancer, that metastasized. It spread to the liver. He's had a liver recurrence 3 times. In total, he has had probably over 10 surgeries as well as 12 rounds of FOLFOX. He's also had J-pouch surgery. He's had 2 or 3 ostomies. So we have 2 young kids. So it has been quite the I guess, as I said, arduous, long, challenging journey. And here we are today, I guess, and I'm happy to be speaking and joining the panel because I firmly believe that it's important to be able to give back and share with others our story in the way of helping other caregivers.
Thank you so much, Enza, and thank you for being with us and taking the time to share with the audience your experience. This is really, really valuable. So, Matthew, would you do the same? Could you introduce yourself to the audience and tell us a little bit more about yourself and your story?
Sure. My name is Matthew Ross. I had my wife diagnosed in the summer of late spring, summer of 2015. We have 2 kids at the ages of 6 and 4 at the time, and she was diagnosed with stage 3 colon cancer, and so it was quite a shock. We knew she was having some issues with some abdominal pain, and she just wouldn't be seen or couldn't get seen for a colonoscopy, and she just kept pushing and pushing, and unfortunately it ended up being stage 3, and it was something that we went through as a family that was very difficult. Fortunately, we came out on the other side, but we had our challenges along the way.
Thank you, Matthew. Thank you for sharing as well. So maybe to kickstart the discussion, a question I would have for you as caregivers, because as you're going through this, you have your own set of emotion. Like we all say, like, again, when you have a diagnostic of cancer, there's a lot of emotion. But as a caregiver, as a spouse, you have your own set of emotions. So where do you get the support? What's your own source of support for you guys to go to continue on the daily? Maybe Enza, would you want to start by sharing a bit on this?
Sure. You talk about these range of emotions, which is exactly bang on in terms of how I feel, how I felt. and the range of emotions I'll just briefly touch on relate to the fear and the anxiety and the those are the two big ones. And I can even list other feelings that relate to exhaustion and burnout and depletion, etc. But what has always been at the forefront of this journey, first and foremost, has been my end in mind. My true number one mission is to help my husband beat cancer. So that is really the driving force, and I feel it in my chest right now, because that has been the driver, which is, what can I do? What are the things that I can do?
And as you're supporting and working through that mission, who supports you, Enza? Where do you get that help? Is there for you a support around you? What is it?
So in terms of the support, it's interesting. The number one support that I have found has been the husband of my dear friend who sadly passed away. So my dear friend passed away, it'll be 5 years this summer, from metastatic breast cancer. And she left 3 children and her husband, about 40 years old. Anyway, he has been the most incredible person to speak to. I would be able to talk to him every single day about what I was feeling and be very honest and raw about my emotions, the truth, because as a caregiver, you sometimes feel you can't share with, so I felt I couldn't share with my husband exactly everything that I was feeling. I felt that I had to be really strong, and this goes to a lot of roles that you have to play as a caregiver. One of them just being, the psychologist or the social worker. So having my friend's husband as the number one support person made an incredible difference, because I could be real and raw and truthful and talk about the ugly feelings and emotions. So I would say that, and it talks to what we heard in the presentation, which is these similar stories. Right.
Thank you so much. So yes, being strong, but you also need to have someone to lean on. Matthew, anything to share in terms of also what is your support? Like, if you look at going through all these emotions, but as a caregiver, and where do you take that support? What is it for you?
Well, this is a few years ago now, so I go when it was in the midst. I think that my wife's mom was very, very instrumental in helping. She was or she is almost like a second mom to our kids, just by virtue of picking them up from school and that kind of thing. And so she took it upon herself to really make food and take care of the kids extensively. The difficult thing for me was that I had just started a new job a couple of weeks earlier. So it was very difficult for me to be able to just take time off and things of that nature. I had just started it, and I was about 40 minutes away from home in terms of the commute. So it wasn't an ideal situation. But that said, because of the nature of who my wife is, there was just this outpouring and this network of that people were dropping food off all the time, and the kids, there was a couple of organizations that stepped up and wanted to have pick up our kids and bring them to some activities, and so that occurred. And in terms of me and how I dealt with it, it was just always a positive thing. It was always something where we didn't, maybe in retrospect, now I think I'm a little more in touch emotionally with how I'm feeling and how I was feeling back then. But at the time, I think the only way that I could forge through it was to deal with it now. Oh, when's the next treatment? My wife had a cocktail chemo where she would come home and it was attached to her, and she had a box of port put in, and so she didn't have the radiation stuff, but she had, the chemo would start at the hospital, I guess, and then she'd bring it home, and it would be I think 24 hours or something to that effect. But it was always, I always downplayed the negative aspects, the potential doom and gloom. It was always just, okay, when's the next session? What do we have to do for the kids for school? Do you need me to do some washing? Whatever the case may be, it was just really, I was just very in the zone, in the now. And if I had any time that I needed, it wasn't really confiding in friends. I really didn't do a lot of that. For me personally, it was playing sports. So if I had a couple of hours because her mom was there to help, or because the kids were sleeping, I would go play basketball or in a hockey league or whatever the case may be. So for me, those were kind of the outlets and the way that we got through things.
Thank you for sharing, Matthew. And again, I think that as I'm facilitating those sessions, everybody has different needs. Everybody, a caregiver or patient, needs to react and have different support. So, Carly, is that as we're listening to these personal stories that are very generous to share with the audience, anything else to share as a social worker on this? How to get the support you need?
I'm just happy to hear that you've both been able to find the support that you were looking for wherever you are in that journey. Matthew, what you said about, your mother-in-law being very there and instrumental and taking a little bit of that practical burden off of you and allowing you to be there for your wife, can make a huge difference. And that's when I talked about the resources versus the demands, I think that kind of illustrates it a little bit. What resources are there at your disposal, and how can it help you kind of alleviate a little bit of that burden? So I'm happy to hear that. Maybe what's important is also just the lived experience. I'm curious to know from either of you if you've, encountered other people. I think, we heard a little bit from you, Enza, about the relationship you have with your late friend's husband, and that lived experience can make a massive difference. So. Important to remember.
Well, the other aspect
Absolutely.
for me, I think. Oh, sorry. Go ahead.
No, that's okay.
No, I was just going to say that the other aspect for me was my wife was very resolved in trying to bring normalcy to the kids, and so even if she had something attached to her, she still wanted to make lunches. She still wanted to do this and that. She was still, we had to try and slow her down. Sometimes my role was to, ensure that she was getting enough rest, and it wasn't always about, I don't know. I just didn't focus very much on what I needed at the time. In retrospect, some of the things I could have done differently, sure, but sometimes because she was acting so, normal, or she wanted normalcy as much as possible, sometimes you'd forget what was going on and what was being faced. So it was an interesting time, and when it was all over, at least it's never really all over, but once you got a bit of distance from the chemo sessions, and once you've gotten a couple of remission type of results, then you kind of say, wow, that was that was pretty scary.
Thank you, Matthew. Enza, did you want to add something? I didn't want to interrupt because I know you were. Go ahead.
Sure. I was going to just to talk to the shared experiences. I met a few lovely people during Vito's chemo sessions. So, and then I became very close to one of them, and so we always chat. We chat, once a week. We'll FaceTime. We'll call each other. We'll share. So her husband is the same age as my husband. She has also young kids, and so we can talk. And their situations, the situations are different, but you can relate to each other as moms, as wives, as ones who take care of the household, as ones who have goals and dreams, etc. So we can talk to how we're feeling. Again, how we're feeling at different stages of the journey. So because there are definitely different stages of the journey and different things that we're going through and different feelings at various points. So, for example, I'm self-employed. I'm also a mom and a wife, and you have all of these different roles, and all of these feelings come up depending on where your demands are, right? So it's nice to be able to talk. I met someone during Vito's chemo, and we connect. We talk a lot. I can pick up the phone and say, how's your husband doing? Or how's Vito doing? Or what test result did your husband get? And she would ask the same. And then we're like, well, what does that mean? Or, well, but how do we cope with that? And we help each other sometimes even, take a step back when we feel like falling off the cliff.
Yeah,
so,
creating that comfort zone with someone that has lived through it. Huh?
Exactly. And I do feel that that's really important, because something that I don't know, something that I personally felt, and we talk about, when sometimes you expect certain people to step up and they don't, and you get a bit disappointed, and then you're surprised and delighted by people you would never expect to step up, and they come and they bring you food. And, that's important too, because there are parts of this where some people, I didn't always feel supported, and I didn't always feel like people understood, and I didn't always feel like people really got it. And I also sometimes felt that people, they don't know how to respond and react. And so it's not a good feeling, but it's not their fault, right? They just don't get it. And we hope they would never have to get it, because it's an awful experience to go through, but that can be very isolating. And I think that's important to bring up too. So that's why being connected with people who have a shared experience is really important and has been extremely helpful for me.
Thank you for sharing, Enza. And through that, have you ever, both of you, because I know, Matthew, you were talking about saying it's a bit in the past and now where you are, but have you ever felt in your journey with your spouse that you had a very different perspective of what was going on in terms of the cancer and everything else? Was that a reality, having a different perspective from hers in terms of what was happening at that time? You're on mute, Matthew.
I do remember me being, focused on the positives and on the normalcy, and maybe some of that was to help me personally get through it and not think about the negative stuff. But I remember her at some point saying, listen, you need to let me feel sad, or you need to let me, think about some of the negative stuff that comes along with this. It can't just be rah, and everything's fine. So I remember a little bit of that, that that she would insist on. But no, we fortunately got through it. She's, it's been, she was diagnosed in June of 2015, I think, and she had her last chemo in February of 2016. So here we are many years later now, and she's, in very good shape and in terms of her health. So I can't complain. Everything worked out. So I don't want to second guess it too much, fortunately.
Carly, you mentioned in your presentation a little bit kind of that impact on the couple, but the caregiver, the family. We have two spouses here in terms of having their loved one into this. So anything that you can relate to and share a little bit in terms of some of the things that, I hear a lot from Matthew in terms of that communication, that kind of being there and being able to have that communication. Anything from your perspective in working with caregivers and family that you can share on this?
I appreciate the question. I think Matthew and Enza have kind of described it better than I can. I'm by no means an expert. I just help people however I can within the confines of my job. But what I can say is, what Matthew said about trying to acknowledge the reality while also trying to keep things as normal as possible is really, is a really important thing that I see a lot in couples, especially couples with children, trying to acknowledge what's going on, but in a way that allows you to still have some semblance of a life is a very delicate balance. I think what Enza was saying about finding this other woman whose husband was also in treatment and being able to relate to one another on those various levels, that's life-changing. And I'm glad you found it for yourself. And when you don't find it for yourself, that's what I do, right? We try and make those connections when you don't make them organically. So those are really important things that I think are good to remember.
Okay, thank you, Carly. So maybe before we go to the audience for a few questions, and any kind of last key takeaways that you could share with the audience in terms of caregivers, things that you've learned, and a key thing you'd like to share with the audience before we move to the Q&A.
I would say, and it sounds very cliche, and I'm sure we've seen this all over the place, but through this experience, I have learned that we should be a bit more kind to ourselves, because as caregivers, we're really doing the best that we can. And we talk about the multiple roles that we all have. And I think we have to just be kind and say, you know what, we are doing the best that we can. We're doing the best for our spouse, our children, our family, ourselves. So let's just give ourselves a little bit of a break, and be kind to ourselves.
Such a great way to end this kind of panel discussion. Like, don't judge someone, just think about what they could be going through, and that kindness. Thank you. So now I suggest we go to the audience, and I will turn the MC role over to Louise Wardrop, the Marketing Event Manager at Colorectal Cancer Canada, to lead the Q&A session. Thank you all.
Oh, so sorry. I didn't realize that I was on mute there. Just a classic mistake, I guess. I was saying thank you so much for joining us. I really did appreciate listening to all of you share. We have a question, which is there a group where I can connect with different caregivers?
I can answer that.
Okay. Of course.
Sure. I would say, I think that we need to do better for caregivers in general. We did a small closed group for caregivers in the earlier spring, and it was on different ways of kind of taking care of yourself as a caregiver. Right now, we have a support group for patients and caregivers together. So actually, it's interesting how they learn from one another. Caregivers, who come in saying, I don't know how to support my mother, my sister, my spouse. And they learn a little bit from patients, different ways to support the person they're trying to take care of. But I think we need to do better in offering caregiver-specific groups.
Okay, that's great. Thank you for sharing that. So at this time, we don't have any other audience questions for right now. But I was thinking maybe we could just continue sharing some. Go right ahead.
Yeah, one thing I did want to I didn't get a chance to wrap up with in the previous portion was that people need to not be afraid to ask for help and need to be okay with accepting help. And I think that was a big thing for us. My wife and I are kind of self-made people, and we've always found our own way and worked our own way. But it was hard initially for us to be kind of, fussed over. And that's really not the right word. People want to help. People want to help comfort and pick up some of the slack. And it gives them pleasure to know that we're benefiting from their help. And so I would say that that's a big piece of advice that I would give to people that are going through something like this is don't be afraid to ask for help. It's not charity. It's people that just want to help you and want to either be good friends or good family members, or it's in them to just do good for others. So that's one thing I would absolutely stress.
Yeah, definitely. I don't think this is something you could take on alone, and I think the more help, the better, right? Enza, you kind of mentioned something along those lines of people reaching out, some that you wouldn't necessarily have expected to reach out to you.
Yes, absolutely. So this is an interesting story. My son, when he started a new grade, he had made a new friend. And I met his friend's mom, and we started chatting, and then it kind of slowly came out about my husband's situation. I'd never met her before. And she was the type of person that she just jumped all over the opportunity, such that the next day there was a big order of groceries and paper towel and toilet paper and food. She had gone to a bakery. We're Italian, so she had gone to a bakery and she ordered like all of these frozen meals for us of different types of pastas. And she says, "I'm not going to take no for an answer." And because like, I'm not going to take no for an answer. She was so aggressive and strong-willed because, as Matthew said, it is hard to accept people's help. It's hard to ask for help. And so this woman just jumped all over the opportunity, and she refused no. She refused. She was not going to take no for an answer. And I literally took photos. I'm like, oh my God, my front doorstep was piled high. And it was the most generous thing, and it was the most heartwarming thing. And I had just met her. And it was crazy because it was just crazy. It was just so unexpected. And it was very, very heartwarming and very touching.
Well, it's great to hear. That is so kind of her. I hope she's listening right now to hear that. Matthew, what were some of the obstacles that you and your wife had to overcome to be able to start up accepting this kind of help?
Pride. No real obstacles. It's just changing your mindset, really. There's, when somebody's willing to do something for you, you just have to accept it. There's a time to have pride and say, no, thank you. I want to be self-sufficient. And there's other times that you can say, no, it takes a village, so to speak. And in this case, you really just have to allow it to happen, because that's what people are there for. Either it's we benefited from an organization that helped us because that's their mission, or we benefited from good friends of my wife or family members that wanted to step up and help with the kids. So either way, just reiterating the fact that you can do it alone, but it's obviously a lot easier and more heartwarming and feeling more support is just the better way to go.
Okay. That sounds great. Thank you so much for sharing that. I think our pride definitely can get in the way in lots of different situations, but when you need help, people will be there to help you. Carly, is there anything else you'd want to add to the session today?
I think Enza and Matthew are the biggest authorities on this right now. I think they've shared a lot of really helpful, useful things. And what Matthew just said about, not being afraid to ask for help, that's probably the hardest role of being a caregiver, is trying to figure out what you might even need. We have a patient who has been with us for a little while, and she's going through her treatments, and she talks about kind of I needed to make my village. And, she decided that her dad was going to drive her to her treatments, and her mom was going to make meals for her. And, she had friends that would kind of keep her distracted. And then she came to Hope and Cope for the support groups and for the peer experience. So what I appreciate about that is sort of this idea of creating your village. It can take a village. I mean, they say it takes a village to raise a child. It takes that expression rings true with cancer as well. It takes a village to get a family through a cancer diagnosis. So what village do you need, and what do you have at your disposal? What resources might you have for you, and where can you look for something outside of that? And like I said in my presentation, a lot of caregivers feel like they don't have the right to ask for help. What they're going through is nowhere near as bad as the person they're taking care of. And I would say that it's only going to make you better able to take care of that person by getting the help that you deserve.
I wanted to add something, if that's okay.
Oh, of course.
I wanted to add something, which is, as caregivers, we feel like, and this is where it's not right and we have to let go, but we feel like we have to do everything. Some of us are a bit more controlling than others. And so it is hard to relinquish that control and the responsibility and give it to someone else, especially as if you have other obligations, if you're a parent with kids. It was hard for me to, I wanted to be there for my kids while I was also taking care of my husband. And asking for support to take care of my kids was hard because I'm the mama and I want to take my kids to school and I want to be there when they come home. And that was really hard for me, but I absolutely needed the help with having someone take them to school and be there when, at 10 o'clock, be home for them when I'm at the hospital at 10 o'clock at night, or I'm at the hospital at 5:45 to meet the resident doctors to get the overview of my husband's surgery. So the point is, it's like we have to give up a little bit of control and be willing to accept people's help, and also be clearer with the type of help that we need. And bottom line is be willing to accept it, which was hard for me. It made me feel guilty on a bunch of different levels, because I wanted to be there.
Right. Well, thank you so much for sharing that. And thank you to everyone for coming and being present at this session, and for really being enlightening and encouraging. I really appreciate it. So thank you so much.